If you are on traditional Medicare as your primary insurance and you use your red, white, and blue Medicare card when you go to your providers or even the hospital, then this article is something you'll want to pay attention to because advocates are sounding the alarm about the pilot program they say could privatize all Medicare. And this is something that the Biden administration is moving forward with a Trump era pilot program that could hand over care of millions of Medicare beneficiaries to private, mostly for profit groups. Healthcare advocates warn that a little known plan will limit patients' choice of providers and effectively privatize Medicare for beneficiaries who specifically chose traditional public Medicare because they wanted to be able to select their own doctors. The program was created without congressional oversight and can expand without Congress approval. And so it says here, I'm just going to read a little bit more and give you the link. But it says here, it could potentially complete the privatization of our public precious good called Medicare, says Ed Weisbart, MD, who chairs the Missouri chapter of Physicians for a National Health Program. It violates the spirit of a public health program, which Medicare is, by driving larger corporate profits as a priority over improving our health, which Medicare is remarkably successful at. So already 42% of Medicare beneficiaries are in a private Medicare Advantage plans, to which the federal government gives a fixed monthly fee for each Medicare beneficiary under the plan's care. And it says that in the MedPAC report that they pay a little over 4% per enrollee, and they pay on average $321 more per Medicare Advantage enrollee than traditional fee-for-service Medicare original Medicare beneficiaries. So that's just a little side note from here. So back to the article here. So to which the federal government gives a fixed monthly fee for each Medicare beneficiary under the plan's care. The less money the plan spends on patient care, the more money they and their investors make. So the new pilot program is called direct contracting, which would extend key aspects of this model to other Medicare beneficiaries in 38 states, Washington, D.C., Puerto Rico, and potentially covering 30 million of the 36 million beneficiaries in traditional Medicare. 53 direct contracting entities known as DCEs, most of which are investor owned with ties to Medicare Advantage commercial insurers, have already signed contracts to be fiscal intermediaries between the patients and their providers. So if you want to know more about this article, want to read more, want to be a smart Medicare beneficiary and consumer, look in the link below, and I hope you have a great rest of your day.